Good afternoon, everyone. It is yours truly, Dr. Pierre, your favorite board-certified internist, founder at drpierreblog.com, best-selling author. It's still crazy to even say that. Best-selling author, to repeat that. Soon-to-be podcaster, bringing you another edition of The Lunch and Learn with Dr. Barry, and we are on episode 41. And of course, I still have my special guest here, Dr. Goodyear, future radiologist, superstar in the making. Like I said, we're kind of sad this week. This is her last week, and then she's gonna go right off into the sunset, and really kill her second year of medical school, and she's gonna do great things. So definitely happy that I was able to grace her presence for at least 3 weeks. Much excited.
I learned a lot from him.
Yes. And
I don't want it to end.
The payment has cleared, so she's able to say that now. I wrote the check earlier this week. Hey, Amanda, thank you for joining. Thank you for liking and sharing, as always. Today's special topic, we're going to be talking about migraines, right? Why are we talking about migraines? Hey, Sharonda, thank you for joining. Thank you for liking. Thank you for sharing. Let me do my little housekeeping thing where I have to share it on my personal page because I still got friends who still don't like my business page yet. That's okay, though. We're not going to put any names out there. That's all right, though. So let me go ahead and share this so we can get started. Hey, Amanda, thank you. Let's see. Share this on her personal. Forgot to copy and paste. Now we can go ahead and share it to the personal. On my timeline. I'm gonna share it in my private group as well. And that is Dr. Barry's Health Squad community. If you have not joined, go ahead and join that as well. It's free. Okay, let's get started. So we're talking about headaches. And why are we talking about, in particular, we're talking about migraines. Tomorrow I'm actually doing the blog post. The medical spotlight will be on headaches in general, and I'm gonna, have a nice little graphic for those who want to sign in. Nice little quick bonus for those who want that to get all the perspective takes on headaches, and so very excited about that. But today we're gonna focus only on migraines. Why are we focusing only on migraines? Because I hear way too often patients who come to my office or who tell me, hey, doc, I'm suffering from migraines, right? Because migraines is a very big catchword. They know migraines, they know migraines are really, really bad. So everyone thinks they have them. And for my patients who have migraines, or especially, migraine is like a headache's here, and then migraines are out the screen, right? So it's definitely something I wanted to kind of address and, get those, huge differences out there early. One, so that, of course, you don't keep going around telling people you have migraines when you really just have a bad headache. And two, because the treatment is different, right? The treatment is different whether you're just dealing with a regular headache. And we'll talk about different types of headaches tomorrow versus when you're dealing with just the migraines. So I want to give you an example of what a patient who usually will come into the doctor's office, usually will come into even the hospital. Again, how many of you went to the doctor? How many of you went to the ER for a headache, right? So just to give you an idea how severe some of these migraines are. Your typical patient who is complaining about migraines, one will be complaining about this throbbing sensation of pain that's usually on one side. And why is it usually on one side? Because migraines from an aura standpoint usually tend to affect one side versus the other. If you have a really, really bad headache that seems to go all around, it just kind of seems to be all the way out there, we get concerned, especially from a medicine standpoint, I get concerned of more than just a migraine, right? Just to kind of give you an idea. So, that your typical patient is usually going to be complaining about symptoms of a really, really bad throbbing, and there's usually the sensation to give you this throbbing headache, usually on the left side, usually on the right side, whatever. It doesn't matter what side. It's usually on one side versus the other. And they'll tell you, they felt like it was gonna come on. They had this like queasy feeling. In the medical world, we call it like an aura. Other patients who also experience auras are patients who suffer from seizures. Just to kind of give you an idea of the stratus as far as from the complaints of what they kind of feel. So they feel this really, really bad sensation, pain. It's sometimes they get numbness, sometimes they get nauseous, sometimes they want to like throw up. Very common. Hey Carrie, thank you for joining, thank you for liking and sharing. Sometimes they want to get to the point where they're nauseous, they're throwing up, the pain is so bad. And very typical, especially you see a lot of this on like TV and whatnot, you hear a lot of they can't be in a room, right? A room like this, right? They can't be in a very well lit room because the pain and discomfort is so bad. They just have to kind of close their eyes and sleep it off, right? So that's when they walk into my office, those are that's the story I'm looking for a person who's dealing with a migraine headache. And the reason why I'm looking for that migraine headache, right, is because I have a lot of questions on my end, right? Because anytime, especially on the physician side, right, anytime we hear of someone dealing with headaches, anytime we're dealing with, especially headaches, severe headaches, right, we may be like calm on the outside, but like we start getting crazy too, because we have to make sure, like, is this like something like a surgical emergency? Can this person be having a stroke? Can this person be having some type of like brain bleed? And that's why this pain is like so severe. So these are some of the things like we're thinking of in the back of our head while you may be comfortably telling me you're having this like severe migraine, right? Just to kind of give you an idea of what it looks like on both sides of the chair. So a lot of the questions I tend to ask first and foremost is, when did this start, right? Like, and how did it start? Usually my migraine patients, they kind of feel a sensation. It kind of like grows and grows and grows to the point it's like so severe, right? And again, that helps me, right? Because it's not something where they're just like, out and about doing their normal activities, and then all of a sudden like this severe pounding headache comes and like hits them over the feet. Because again, like I said, from a medical standpoint, like I get concerned, right? I get concerned, like, is this something that, again, I have to worry about? Why do you have to, do I need to send you to the ER? Perfect example. Amanda asked, well, why do they, especially for patients to go to the hospital, why do they do a CT scan in the hospital when you have when you say you have a migraine, right? Because migraine headaches, and because again, we know patients don't read the textbook, and they say a lot of things that are really, really concerning to us for like a brain bleed. So like all of the symptoms that you may be feeling, all the symptoms that you may have read, like, oh yeah, I have like this, the worst 10 out of 10 pain, worst, I have my average tell you, they get that like, oh, this is the worst pain I've ever felt in my life. And on your end, you're telling me this is the worst pain you ever felt in life. On my end, I'm like, am I dealing with a stroke in front of me? So that's why they usually do a CAT scan, because they want to make sure, one, because the CAT scans pretty quickly, so they want to make sure, all right, is this a brain bleed or not? And that's all. And for those, again, I hate to go to radiology. I'm not a radiologist. She's going to be a radiologist pretty soon. So she'll be able to tell us everything once it's all said and done. The CAT scan main job, especially in the ER setting, is to tell me bleed or no bleed. That's really the main job, especially if we're thinking of patients with headaches, if we're concerned for patients with strokes. Bleed, no bleed. That's all I want to know when I do the CAT scan. And the CAT scans are quick. They're like, I think, 10, 20 minutes. They're very quick to get a defined answer. So that's why they always jump and do that CAT scan, because they want to make sure in that first 10 minutes while I'm talking to you, am I dealing with a brain bleed? Because if I'm dealing with a brain bleed, we're dealing with a whole different discussion, right? We're dealing with a whole different discussion that, again, we could talk about, especially if we bring up strokes at a later time. So we have the patient who says, this it's been kind of growing on me, but now like this pain is terrible, right? Hey, Vickley, thank you for joining. Thank you for liking and sharing. Much appreciated. So now we have this headache, and you've told me that, it started slow and it started kind of grow, and it's on this one side. It's on this one side that now, not only is it on this one side, not only is the pain really, really bad, not only am I starting to get nauseous, but now I'm starting to have some issues with the light, right? Like, so now I can't even be around the light. And light sensitivity is a very common symptom that we hear in the doctor's office and even in the hospital setting as well. Migraine symptoms. So I asked, when did it start? Another question I like to ask is this the first time this migraine's ever happened, right? Because we know a history of migraine type headaches leads us to believe that you're likely dealing with a migraine, right? Like if you're 35, we want to go that low. If you're 25, 30 years old, and now you're saying you're having a migraine, but you've never, ever had a migraine growing up, the likelihood of that being a migraine is going to be low. Because we know migraines start young, and they usually just kind of continue on. So that kind of helps us, again, from a physician standpoint, kind of helps us lead us away from, like, is this a migraine or is this not a migraine? A lot of times I like to ask, any family history, right? Like, do you have any family members who suffer from really, really bad headaches that you're dealing with now? Because we talk about the patient who says, I'm having a migraine, but there's a lot of patients who say, I'm having a headache, and don't realize that they're actually having migraines, and they've had migraines for years, and just kind of brushed it off. They've been able to just take some medication and have kind of gotten through their day. From that standpoint there, and we'll talk about some symptoms that kind of like spur on these migraines in a little bit. So I have patients on both sides. I have patients who are clearly telling me signs that they're having migraines, but they just call it headaches. And I have patients who are clearly telling me they're having headache signs, but they keep calling it migraine. So yeah, and that's a very good point to kind of tease together, because again, the treatment is different, right? The treatment is different, especially moving forward. Because I like to ask, let's say if you are that person who deals with migraines and know you deal with migraines, I like to ask, how many have you had in the past, like, year, right? Like, how many migraines have you been dealing with in the past 6 months to a year? Because that's going to help kind of guide my treatment, whether this is something I need to treat on a preventative basis or something I treat like as is, like when it's actually happening. And we'll talk about why, why is that important from that standpoint. So I like to ask, like, how often are you having these headaches? Any other symptoms? Again, I have some patients, they get really bad, like cramping, really bad, like constipation. Just there's these very vague symptoms that they get when they do have their migraine, that they know the migraine's coming. For my women out there, I have a lot of women, because the symptoms of migraine are a lot of hormonal issues as well. So every time they're about to get their menstrual cycle, they get these really, really bad headaches, or they get these really bad migraines. And they can kind of tell you right on the clock, like, oh, menstrual cycle's coming in 3 days, because I already know I'm starting to feel it. So there's a lot of hormonal issues, whether it's be estrogen, progesterone, and some other hormones that play a factor in whether you get these migraines, how often you get them. Stress as well. Again, I mean, there's almost nothing that stress doesn't cause, right? Stress is another big factor in whether a patient is suffering from migraines and how often they suffer from the migraines and what type of treatment I have to do. Because if stress is a big thing for you and that's really causing migraines, I can't really treat the migraines unless I treat the stress. If you kind of understand, that flow of thinking from that standpoint there. So definitely some stress, definitely some emotional issues, definitely some hormonal issues, especially with my women with the menstrual cycle. Definitely family history is a big one. There's certain foods that cause my migraine patients to want to curse the devil out. So there's certain foods that want to, and then there's certain foods and drinks that, kind of help it as well too. For those who may be like coffee drinkers, we know coffee is great for kind of breaking up a lot of these migraine type headaches. The problem is on the reverse side, if you have too much coffee and then you say, you know what, I'm going to stop drinking coffee for a while, you can actually get like some type of rebound type headaches as well, which can kind of look and sound like it's a migraine headache. It's dehydration, definitely for sure. So Amanda asks, is dehydration a trigger for the migraine? And for sure, because from a volume constriction, that's the same reason why coffee sometimes becomes an issue, is because it causes you to dehydrate, it causes the vessels to constrict. And when vessels constrict, that's where, pain and everything else kind of arises from that standpoint. So definitely a proper diet and a food balance and, liquid and food and everything, it can play a big factor in, where we get some headaches. Yes.
Can I ask a question?
Yes, you can.
Are there any common medications that have headache as a side effect, or particularly migraines? So are there any ones that people should watch out for?
For my women, birth control. Birth control is a big one. Birth control is a big side effect is getting headaches. For my patients who may be suffering from blood pressure issues, and especially, again, you may not know the name, amlodipine, Norvasc, a lot of these blood pressure medications that causes vasodilatation, like your vessels actually dilate, can cause some headache symptoms as well. So definitely something, headaches is, medications are a big issue, especially when it comes to dealing with migraines, especially for my patients who are on like birth control or estrogen or any type of supplemental aspects of it. But blood pressure is probably like in like that second category where you have to always be concerned that migraines, is a side effect from it. And so when we talk about the signs and symptoms, we talk about like some presentation, and then why you come to the doctor's office is the treatment, right? So what type of treatment options out there? Questions and that's why I asked in the beginning, like, how often are you getting them? When do you get them? How long do they last? Because I have to go, and I have like two trees, right, when I'm dealing with migraines. Is this a migraine that I have to treat before you get them? Or is this a migraine that I can treat, as you get them? And so let's talk about the people as you get them. The people who are a great candidate for treatment as you get them are the ones who may get a migraine headache every menstrual cycle, ones who may get a migraine headache every 3 or 4 months, seasonal issues, some environmental components, sinuses, everything else can precipitate in that regards. So if it's almost like, once every blue moon per se, you get migraine headaches, those are the ones that we can kind of treat preemptively. We can kind of treat as is. And as is medications include Tylenol, but usually they go through the regular Tylenol. So usually they need like Tylenol, Excedrin, extra strength ibuprofen. Over the counter ibuprofen is like 200 milligrams. My patients usually have to get about 600 milligrams, so 3 of those over the counter tabs, just to get a dent in their headache relief standpoint. Aleve is a very popular medication as well, because Aleve you take twice a day, and generic wise naproxen which is Aleve. Naproxen from prescription strength is about 500 milligrams. The over counter Aleve is about 375 or 25. It's lower. It's like 300 something. So it's definitely lower from that standpoint there. So definitely a couple from a medication aspect of what we can take, to relieve it now. Also a different class of medications, and for my patients who love to read the diagnosing of this medication, the family of triptans, which are your like Imitrex is probably the most popular one that a lot of people know. Those are the types of medications that you can take. Like if you're getting a migraine, you take, and that gets the migraine out of there. The problem is a lot of people can't tolerate that medication in the sense of when they take that Imitrex, they go to sleep. Because it's such if you think about it in terms of like the weather, right? A migraine is like this electrical storm kind of going off in your head, right? And the triptan medications put a stop to all of that. But the problem is they put like this cloudy sensation over your head, and a lot of people really can't tolerate it. So once they take their medication, that triptan medication, yes, it knocks out the migraine headache, but they're also so tired that they have to go to sleep. So it's a very popular one. It's generic as well, so which always makes it a popular choice, because you're not paying an arm and a leg for it. I think Relpax is another one. There's some other like the brand names, but the most important one, or most common one you'll probably see is the Emitrex from that standpoint there. So those are my, if it acutely is happening, what can I take? Now, what happens if I get migraines 2-3 times a week? I get migraines, like that often. Those patients are not going to do well. And I've seen this. Those patients are not going to do well on you giving him, Aleve, Motrin, Imitrex, especially because for one thing, from an insurance standpoint, insurance is only going to give you about 10 pills of the Imitrex, because they say if you need more than 10 in a month, clearly your migraine isn't being controlled. So those people who suffer from the migraine symptoms so often that we actually have to start treating it like before they come. And those I've got patients from age 17, and I got patients all the way up to like age, like I think my oldest patient on that this type of medication is like 67 or something like that. So those patients need a medication that you have to take every single day to prevent the migraines from happening. And in fact, my best story is I have a patient who is in high school now, and he had been suffering from migraines for years. Like, he had been suffering from middle school up into high school. He was having trouble in school, and with these terrible bad headaches that pretty much kept him out of school. He'd have to miss the whole day because the headaches were so bad. But of course, he hadn't seen a physician in a while. For whatever reason, I hadn't seen a physician in a while. So when I saw him, and he kind of gave me this story, and he was like, "Yeah, like it happens like 2-3 times a week. I'm not finishing my study. I don't do anything after school." Like, this was a person who was like screaming to be on medication from a proactive standpoint, right? Screaming to be on medication beforehand. And we put him on medication called propranolol, very low dose medication that he just takes twice a day. And he says his migraines went from occurring every 2 to 3 days to one like every 6 months. Like, I mean, drastic change, right? And that's the change we're looking for, right? We're looking, and again, his was an outlier, but like that's what's supposed to happen, right? When you're taking a medications to try to prevent these migraines, you shouldn't be happening every day like it was before, right? So we are very, very happy with his results. So I have a few patients on propranolol, which is a great medication that you take twice a day. I have patients on diltiazem, which is again another medication that you can take every single day to prevent these migraine headaches. I had patients on Elavil or amitriptyline, another medication that kind of functions as like a seizure type medication as well. Because remember, migraines are like a neurological issue, so that definitely helps from that standpoint there. I have patients who actually have to get injections, right? Botox injections to stop like the migraine symptoms, right? So we've got a wide range of treatment options for you. The goal is just making sure that we got you in the right setting, right? Because if you're having regular headaches, right, I don't want to have to give you Botox injections. If you're having regular type headaches, I'm not going to give you a medication that you got to take every day. So that's why it's important for us as a physician, but even you guys. And again, my goal, especially with everything I do, especially with these lunch and learns, are to take what may be like a complex medical topic and try to break it down in layman's terms as possible, so you guys are empowered with the knowledge as well. Because like I said, I know you guys love Google and WebMD, and I got no problem with those, right? I actually have zero problem if you like WebMD and stuff. The only issue is, and again, I could probably speak for a lot of my physician friends, right, is when you didn't turn around and bring the Dr. Google, the WebMD printout, and all these other, when you bring them to the office, right, and then you tell your physician, like, no, I printed it off this website, and I'm going to go off this, right? That's where we start having problems, right? That's for another discussion. But that's where we start having problems with the whole WebMD. But like, if you like to educate yourself, and you're not, because I can tell you right now, and you can do this with Google headache on, go to WebMD and do headache, it's going to say brain cancer, right? So that's the problem, right? Because I don't want you to go looking at WebMD, and then it says I have a headache, and then it says one of the causes of headaches is brain cancer, and then you tell me you have brain cancer, right? Because that's where the problems arise, right? So that's where the Dr. Google and everybody else kind of differentiates, because we don't want that to happen. From that standpoint, there. Do you patients like break too? Oh no! So I have a lot of patients who love the Excedrin migraine. Excedrin migraine again, which is like it's a Tylenol base, but it also has caffeine in it. So a lot of those, when you, and again, go to the store, when you guys are done, and when you go to see those prescription bottles that say something like blah 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 migraine, you'll see that you'll either include Tylenol or ibuprofen, but it'll also include caffeine, right? And that's what we kind of talked about, with caffeine being a benefit, especially for some patients when they're dealing with their migraine type symptoms, right? So a lot of these migraine type medications usually have caffeine in it. Oh, we didn't talk about one from the acute setting, but a lot of people use Fioricet, which is like it's 3 medications. I know one of them is caffeine. The other is like a couple of classes that really not important right now, but that's another medication you can use, moving forward. The only problem with that is that your body gets used to it, right? And again, unfortunately, I have patients who been taking Fioricet for so long, they can't get off the Fioricet, right? And it's the same thing like my coffee drinkers, right? They drink coffee so much that if they take the coffee away, they start getting these rebound headaches, right? So that's the only caveat and concern we have for those types of medications. But definitely love Excedrin migraines. Another medication, I have some people who use the Goody powder, which is like a powder that they put under their tongue. They say it works great for migraines. If you got something that works great for your migraines, and it obviously it's safe, definitely continue to use that. Like, that's definitely not a problem, especially on my end here. Again, like my goal is to make sure you're better, right? So if Goody powder gets you better, perfect. Excedrin migraine, perfect. Like Aleve, perfect. Whichever one helps get rid of your migraine headaches, that's really the goal for us from that standpoint there. Kind of moving forward. And so, like I said, I know I kind of hit you guys with a lot on the migraine front. You know what? I may do like a quick PDF just to kind of give a quick summary. I'll send that. If I do, I'll send it out. I'll put it on my website. Make sure you check my website. I'll put it on the website, and then y'all can download that from there if you want like notes and from that standpoint. So again, like I said, I don't like to do this thing as long. I don't want to give you guys too much information, but I just wanted to kind of put it out there so you guys were fully aware. The very stark difference when we talk about migraines versus like other headaches, right? And tomorrow's post, again, medical spotlight we do on Wednesdays will be on headaches in general. It's going to be a nice little slideshow, and we'll do a nice little slideshow. I'll do a PDF version for people who want to like sign in for if they want to like a downloadable PDF version. I can make one as well too. But we'll have like a slideshow that just kind of talks about headaches and different types of headaches from that standpoint. There, maybe we'll talk a little bit about treatment, but I don't want to get too detailed tomorrow, because then because I know how you guys do. You guys will be running for the hills with that type of information. But we'll definitely get you a nice little overview or what types of headaches are out there, what type of symptoms to expect of those headaches, so you'll be properly informed and educated when you go to see your doctor and you say, hey doc, I'm having a tension headache, I'm having a cluster headache, I'm having a migraine. And trust me, if any of my patients come and say I'm having a cluster headache, one I'm going to definitely ask is, how do you know it's a cluster headache, right? Because now I want to be educated too, right? Because again, doctors love to be educated as much as anybody else, right? From that standpoint. So again, for all of my replay viewers who are going to be catching this later, first of all, thank you for joining. Like I said, we're excited. This is our last Lunch and Learn with Dr. Goodyear. She's been amazing this month. Thank you, Florida State, for sending me another great student. Florida State tends to be great students. Of course they do, because they're my alma mater as well, so why wouldn't they not send me great students? We're very excited. Learn about migraines. Tomorrow we're talking about headaches. And remember, this Thursday we're not having a Lunch and Learn. Actually, I have a meeting. Have a great blessed day. Join the Facebook group. Join the Health Squad community, and you guys be easy. Bye.